I wanna be more, yes, more than just friends. A little bit more than just friends.
Good day, everybody. I wanted to talk a little bit today about pharmacology. So this video is mainly for my nursing students or med students that are finding themselves having trouble memorizing medications. It is not easy to do so, and let's just be honest, there's way too many medications on the market for us to remember each and every medication that we needed to know. So I have here in front of me the Davis Drug Guide for Nurses. This will come in handy no matter what stage of school you're in or which part you're trying to learn. However, it has a wealth of information inside of it, so you know it is a lot to take in. However, as you can see here, it has the drug. It usually has the generic and the brand name, and then it has the classifications, what it's used for, the mechanism of action, and so on and so forth, common side effects. So I do like to use this as a guide for extra information. However, first, to make life easier, I'd like for you guys to check out the Learning Extension Pharmacology app. It's flashcards made by NCSBN, which are the people that actually make the NCLEX exams. So they've created an app that basically has the most common drugs that you would need to know to pass your state board exam. And when you click on the app, it will tell you the mechanism of action, the generic and brand name, and also like the most important things you need to know pertaining to this class of drug or these specific drugs. So once you delve into that, what I do is any information I could not get from the app or the flashcards, I then go into my Davis Drug Guide. I find the drug that I'm looking for, and then I will look to see if there's any specific information that I may need to know, like does it specifically pertain to kids, or is there a certain dosage I may need to know for children. And most importantly, you want to pay attention to this part: nursing implications. What do I need to know as a nurse? That's what you should be focusing your study on. Lab values, you also want to pay attention to. What should I be looking for? So what I did was I gathered all this information and I purchased an Erin Condren notebook. Now, obviously you don't have to have an Erin Condren notebook to do this, but that was just my go-to. I purchased an Erin Condren dot grid notebook because I like being able to customize my pages the way I'd like to. And what I've done was I took all the drug classes on the Learning Extension app and I put them in here ABC order. Now, excuse my book because some kind of way something got spilled on it, and so the bottom of most of the pages got messed up. So I will be redoing this app, and who knows, maybe I might even do a video to show you just exactly how I do this. But what I've done was I took all those medications and I put them out into a book, because what we know is that utilizing more than one way of learning helps you retain information more. So you want to do something that will help you visualize it. Obviously, you're going to be hearing it in class, and you can also look at additional YouTube videos to hear, the medications and things that you need to know. But I always say use more than one method. So what I do is, in order to visualize it, I usually use a concept map in addition to creating my drugs. And I'll go more into that in a second. So, for example, this is what I've done. I've taken the meds, and under examples is the names. So I have the class at the top, and then I have the generic and brand names on the side. And then what I've placed over here is what they actually do in the body in layman's terms, so that I am able to completely understand what this drug does. And then here I put what it's used for, and you can see that on both pages. And then if you go down a little more, I will put common side effects. Excuse the mess up. On this page, you can see, there's the common side effects. In red, those are really dangerous side effects that people can or have experienced. And then if it's anything with stars, those are things that we absolutely need to know when it comes down to these drugs. And same thing with the bubbles here. And so what I also did was, based on the type of drug it is, I put a little drawing or symbol like the heart and the brain to show exactly which part of the body it represents. That way it clicks in my mind a little better. Oh, if I see anti-anxiety med, I know it's something working on the brain. Or if I see anti-anginals, I know it's something working on the heart. And so on and so forth. And you can see I've done the same thing with anti-asthmatics. I've tried to draw some bronchi. It may not be the best, but it's just something to help me remember more. So again, I have my uses. I have something that we need to know, specifically need to know pertaining to these meds. And we all know that with antiarrhythmics, digoxin is the big one, the big drug that they love to question us about, and the therapeutic range. So that is definitely something that I always try to keep a mental note about. And so what I've done was I just went through and I did this for each and every drug. And I know some of you may be thinking, well, how in the world does she have time for that with everything else that she has going on? What I did was I just labeled the top. And if it seemed like a drug class that has a lot of information based on the flashcards, I just left an extra page for that. And so I'll leave, like, for example, the anti-asthmatics. It seemed like it would be a lot, and it was. So what I did was I left the entire page for it, front and back. And then whatever concept I was using or going through in school, I would go in and fill in that drug class. So, for example, if let's just say we were learning about hypertension, and I might go to, let's say, calcium channel blockers, for example. Let's go there. There we go. Calcium channel blockers. And so I have my little heart here, and this was something that helped me remember that calcium channel blockers is basically like Valium for the heart. We all know what Valium does. And so if someone were to ask, well, what kind of calcium channel blocker would you use for a patient with hypertension or blood pressure problems? Then I might say verapamil. And so you want to try blending those concepts, meshing those concepts together. So whatever concept you're learning in class, try to go to that drug class and delve in more about that class. Don't focus so much on the actual names, but on the class itself. And most of these have similar name endings. Like beta blockers, we all know that beta blockers for the most part end in LOL. So you want to look for those type of similarities to help you remember the specific drug classes. And then you want to focus on what do you need to know specifically as the nurse. As a nurse, what do I need to know? And so, see, we have here that calcium channel blockers can act as a male contraceptive, which stops entry of sperm into an egg. So if we have a patient that is trying to become pregnant or has had difficulty becoming pregnant and they want a baby now, we definitely want to take that in consideration when putting them on, or when the doctor is prescribing them a calcium channel blocker. We need to have this conversation and provide this education to the patient. That way they can decide whether, yes, this is something they want to take, or maybe we should find an alternative method that the doctor can possibly give them. And see, we have side effects here. And again, when it comes down to side effects, you want to focus on the specifics, like what is specific to this drug. Like, for example, bronchodilators can cause paradoxical bronchospasms. That is very important to know. You don't want to focus on non-specific side effects like nausea and vomiting, because as we know, nausea and vomiting applies to most medications. Or GI upset. Most meds have the ability to cause GI upset because they may need to be taken with food. It just depends on how your body reacts to it. So you want to focus on side effects that are very specific to whatever drug class or specific drug that you're looking for. Here's another one. Loop diuretics. Diuretics are prescribed all the time, especially like furosemide. And if you can see here, I know it's a little messed up, but I put a star next to furosemide because that is the most common diuretic that is prescribed. And so I need to know that. But what is most common to the diuretics is that it can cause hypotension. So we need to be able to explain that to the patient that, hey, while you're on this medication, hypotension is a very big possibility. So what do they need to know? They need to know that upon rising, they need to rise slowly to prevent any chances of a sudden drop in blood pressure. Certain things like that. That's where meshing those concepts really come into play. And again, when I talked about creating a concept map, I'll do another video later on to show you exactly how I do my concept maps. So what you want to do is when you have a concept, you'll put it in the center, much like what I'm doing here. So we can say that the medication is my concept. And so I've made a list of things that apply to this specific concept. It's the same thing when I have a concept like hypertension. What I would do is I would put hypertension in the middle. And then when I put hypertension in the middle, I would draw my branches or whatever the case may be to lead to things that I need to know. Common drugs utilized for hypertension. I would put side effects. What lab values may be affected, if any. And I will also put, what do I need to know as a nurse? That's the most important thing that we need to be focusing on. And that's why the Davis Drug Guide comes in handy so well, because they outline that for you. I know every school utilizes a different pharmacology book, which is why I don't really solely go based on the school's pharmacology book. But again, if you look into the Davis Drug Guide, it tells you straight up nursing implications. So then you'll read through this portion based on whatever drug class or specific drug that you're looking for, and you will just make note of the things that are most important that we need to know. Like, for example, this drug, dicyclomine, The action is it may have a direct and local effect on GI smooth muscle, reducing motility and tone. So, as a nursing assessment, we may need to monitor them for irritable bowel syndrome. That would be something important to know. And then lab test considerations. Avoid administration for 24 hours preceding the test for any antagonizes effects of pentagastrin and histamine during gastric acid secretion test. You know, you want to pay attention to those things. Anything that has a toxicity and overdose potential, you definitely want to notate that. And so you would just put those things, again, like I have, in your notes, however you want to detail your notes. Some people, you know, they like making lists, or whether a graph or a flow chart, or, you know, just bullet points. However you want to do it, you just want to make sure that you have all the important factors there. What's the class? What does it do? Why do we use it? You know, pick something that's going to help you remember, why do we use this? Again, do this for every new concept that you learn in school, and you'll see that over time, you're learning a lot more about these different drugs. And there we go, our side effects. There's that orthostatic hypertension again, you know, and this is for our alpha blockers. So you just want to keep note of the most important things. What do I need to know as a nurse? And that will get you through. So anyway, that was just my little tidbit on pharmacology and a few ways that can help you remember what each drug is for, and, you know, how to study for your exams. Because when I have my exams coming up, I just refer back to this book, because instead of reading pages and pages of notes, now I have it in a simplified version. This is exactly what I need to know, all in one page, 2 pages max, you know, and that makes it much easier to review on a regular basis. And like I said, I purchased this little notebook through Erin Condren. It fits in my purse. I can put it in my backpack. I can do whatever I need to do. And my drugs are accessible at all times, whether I'm waiting on something or I'm in the line at school waiting to pick up my kids. I can just pull this out and go over briefly these different drugs, and that way it's staying fresh in my mind. So you want to think about that too, something that's easy to carry around. Even if you want to buy the little flashcards on the ring, you know, I've done that as well in the past. However, I just found that this little notebook was a better method for me. So you definitely want to choose a method that works great for you and try it out. I think you'll be happy with the results if you stick to it and, you know, review. That's the most important thing about pharmacology. You have to keep reviewing that information and keeping it constant in the forefront of your brain. This is definitely not a topic that you can just dump. We brain dump a lot of things because we have to learn so much as nursing students and as nurses in general. You know, we tend to get rid of things that we think we don't need anymore, but these drugs are for sure not going anywhere. So we definitely want to, you know, find better ways to retain that information, and utilizing more than one method, such as hearing it, seeing it, in these different things. It will definitely help to stick in your brain a lot more. So if you have any questions, comment down below. Let me know what you think. Even if there's something that you think that I could do better, feel free to let me know. I am all ears. Again, thanks for tuning in with Simply Keish.